We're covering the skeletal system. I'm going to mix the axillary and the appendicular system. We're going to start out with the sternum, and then we're going to work our way all the way down to the arm. One of our previous videos, we looked at hands and feet, so let's just start with the sternum. We can divide it into three sections. From my pointer up, this is all the manubrium. And then the bottom or distal portion is called the xiphoid process. Xiphoid means sword. Manubrium means handle. So the handle is the manubrium. Everything in between the manubrium and the xiphoid process is the body. So I have three regions: manubrium, body, xiphoid process. A couple other landmarks or bony landmarks to learn. On the top, this ridge here on top is called the jugular notch. So jugular notch. On the sides for the clavicle, clavicular notches. So clavicular notch, jugular notch. And then where the cartilage is connecting for the ribs, these are all costal notches. Costal referring to the ribs. So costal notches. Keep in mind, this is not bone. This is cartilage. What type of cartilage is this? Remember, there's three types of cartilage: hyaline, fibrous, and elastic. This is hyaline cartilage. So this is the sternum. As we move on to a rib and connecting the rib, I have two ends that we're learning. The smoother end is referring to the sternal end because we're going to get that connection to the cartilage of the sternum. So sternal end is my smooth end. My rougher end, where I have these projections, is the vertebral end. So two ends: vertebral end and sternal end. A couple of the landmarks that we'll learn: the actual end or the head of the vertebral end is the head, and then in between is the neck. So at the vertebral end, I have head and neck, and then I have a tubercle. So I have this tubercle here. As I come down and I look on the inferior side, and when I'm going in the posterior portion of the bone, this is costal groove or sulcus. Maybe hard to see on the screen, but when you rub your finger through here, you can see a groove, and that's to protect some of our nerves and blood supply. And then when I determine right or left on this, remember I said that this is the sternal end, so it's got to go to the sternum either here or here, but I need that costal groove to be on the inferior side, but also posterior. So this stays down. This has to go to my vertebral end. So this is a right rib, if you can imagine it on my body. So a right rib. As we move on to the clavicle, this is our collarbone, but now we call it the clavicle. And when we look at this, the top part of it, or superior part, is smooth relative to the inferior portion. As we learn the inferior portion, that's where we identify a couple of our bony markings. Again, two ends. I have what's coming to the sternum. This is the sternal end, and this is the acromial end. And the acromial end looks like a spoon to me, and it'll look like that on the scapula too. So as I come down to the sternal end, this is going to connect to the sternum either like this or like this. And so sternal end, acromial end, so two ends. And when I turn it on the inferior side, at the acromial end, we're learning this projection here, which is the conoid tubercle. Conoid tubercle. So it's a little bulge or bump on the inferior side. When I come over to the sternal end, there's a rough projection here called the costal tuberosity. So these can be difficult for students, but as I look at the smooth side is my top or superior, the bottom is my inferior. On the acromial end, we are learning the conoid tubercle, and the costal tuberosity is this rough projection as we get close to the sternal end. Right or left with this, I use again that the top is my superior side, that's that smooth section. And when I follow the acromial end, it curves like a spoon, and I want that spoon to project out anterior away from me. This is a right clavicle because I have to put this at the sternal end no matter what I do with this. But as I follow the acromial end, it comes out and points away. So this is a right. If I turn this way, the acromial end is going to stab me with that spoon. I don't want that. So this is a right clavicle. As we move on to the scapula or shoulder blade, it's kind of a triangle, so three sides of a triangle, so we name those as borders. This is a superior border. This is an axillary or lateral border because it's going to be at my armpit. And I know this is lateral because I have this connection here for my humerus, and that landmark is called the glenoid cavity. So that has to project lateral. And so that glenoid cavity is going to project this way. So I know this is my lateral side or lateral border, also known as axillary because it's my armpit. This is medial border because it's going to be more medial, and it's also called the vertebral border because it's closer to the vertebral column. On top, superior border. So three sides of the triangle: lateral border, superior border, and medial border. As I look at these projections, these are processes, and the big one on the posterior side, this end is called the acromion or acromion process, and it's connected to the scapular spine. And this is what you can feel on your posterior side of your back. So scapular spine runs and becomes the acromion process. Scapular spine, acromion or acromion process. If you notice, it looks similar to the acromion of the clavicle. So they look similar. So I still have that spoon appearance. Acromion process, as I turn it and I go back to anterior, coracoid process. Coracoid process. So with the C and a C. Coracoid, acromion process. And then when I look with this scapular spine, I have a space above it called the supraspinous fossa. Below it, infraspinous fossa. So above the spine, supraspinous fossa. Fossas are depressions. Infra, below it. So we're learning those two spaces. When I go on the anterior side, and if to go anterior, I have to go deep. So we go sub or below. This space where I can rub my hand is called the subscapularis fossa. So subscapularis fossa, supraspinous fossa, infraspinous fossa. Why are we learning this? We're building the language. We're going to attach muscles here when we cover muscular system. When we look at that connection again, we said that space is called the glenoid cavity. There's two projections at 12 o'clock and 6 o'clock. One's called the supraglenoid tubercle at the top. At the bottom, infraglenoid tubercle. So 12 and 6 o'clock, supraglenoid tubercle, infraglenoid tubercle. How do I do right or left with this? Remember I said I need that connection for the humerus. So this has to point out either this way, or I have to turn it. It's going to go like that. But this is not going to sit well. When you feel this on your back, that subscapular area is going to be deep on my back. But the scapular spine has to point out posterior, and I need that connection for the glenoid cavity. So this is a right scapula. Moving on to the humerus. The first thing I want to show you is these two colors with the pipe cleaners as we describe some of our necks. The rounded portion where we're going to connect to the glenoid cavity of the scapula is the head, so humeral head. The necks, there's two different types of necks. When I go around with the pink one just underneath the head, this is called the anatomical neck. The green one is referring to the surgical neck. So two types of necks: anatomical, surgical. The reason we call it surgical is this is right at the region called the metaphysis, where we have the epiphyseal plate or the growth plate. So if we have damage or we break or fracture the bone here, it could end up in surgery. So two necks to learn there. Now, as we move on to the rest of the bone, I'm showing you a right. Remember, we said this is the head. When I look anterior, this projection on the anterior side is the lesser tubercle. Lesser tubercle. On the lateral side, this big one here is greater tubercle. Greater tubercle. Because of those two tubercles, I have a space in between called the inner tubercular groove or inner tubercular sulcus. So lesser tubercle is more anterior, greater tubercle is more lateral, and then I have that sulcus or groove in between. As I come down the shaft, it'll bow here more on the lateral side, and it'll get rough, and that rough portion is for the deltoid muscle. So we call this the deltoid tuberosity. So where it becomes rough and creates somewhat of a bow here, this is called the deltoid tuberosity. As we come down to the distal end, we're learning condyles. And there's 4 here. 1, 2, 3, and 4. So 4 condyles. As we learn this, these are 2 epicondyles. Epicondyles towards the edge. On this side, this is the lateral epicondyle. The bigger one from here over, this is the medial epicondyle. Medial epicondyle, lateral epicondyle, and then the 2 specific condyles in between. The first one that's rounded like a cap. To me, I remember like a baseball cap, and the word cap is in capitulum. So capitulum, capitulum. And then from here to here, all of this is called the trochlea. And students will always say it looks like 2, but it's all 1 because it grooves down and turns, and it looks like it's 2. But all of this is trochlea. And we use that to hinge my ulna inside there. So we'll come back to the ulna, but in review, lateral epicondyle, medial epicondyle, capitulum, and then all of this is trochlea. Trochlea. 2 fossas to learn, one on front, one on back. So on the anterior side, coronoid fossa, coronoid, and we learned coracoid process of the scapula, so it gets a little crazy. On the anterior side, coronoid fossa. Posterior, the larger one, is the olecranon fossa. Olecranon fossa. Right or left with this, I know all of these condyles have to be anterior. So if these are anterior, I need the smooth side of my humeral head to go into my body on the medial side. So I use this to connect to my scapula. So this is a right. If I put this over here on my left side, now I have this rough greater tubercle that's going to hurt when it moves. So this is a right humerus. So then we look at a ulna, my elbow bone. Remember, we said we're taking this and connecting into the trochlea. How do we do that? It's through this C here called the trochlear notch, often called semilunar notch because it's a half moon. So trochlear notch because it hinges inside the trochlea. And how does it do that? Through these 2 processes. The top one, which is essentially my elbow, the olecranon process, is that projection on the posterior side. On the anterior side, we have the coronoid process. Coronoid. Coronoid process, olecranon process. So the 2 processes go into my 2 fossas. My olecranon process is going into my olecranon fossa. My coronoid process is going into my coronoid fossa. So they connect together. As I follow the coronoid process of the ulna, to me it looks like it kind of breaks open here. So all of a sudden there's this little ridge here towards like a nice circle, and then it breaks. It doesn't literally break, but I just imagine that. And that point there is called the radial notch because I'm going to use that to attach the radial head. So the radial head goes in the radial notch of the ulna, and that'll help me with right or left. So radial notch. As I come down, the rough projection going more distal. This is the ulnar tuberosity. So ulnar tuberosity. Further distal, ulnar head is the rounder portion. Ulnar head, and then the styloid process, ulnar styloid process. Now this is another styloid process you learned it on the temporal bone as well. So ulnar head, ulnar styloid process. How do I do right or left with this? I said this is the radial notch, so I attached the radius for this. In anatomical position, we said my radius is my rad bone on my lateral side. In anatomical position, my pinky side is my ulnar bone. So if this has to be on the medial side, if I put it on the left, I can't connect my radius because the radial notch is on the wrong side. If I put this on my right side, now I can connect my radius. So this is a right ulna. So if we add to that, here's my radius. The head switch. So now I have the head on the proximal side. So the round head, radial head. As I come distal, this is on the anterior side. This is called the radial tuberosity. So this bulge, radial tuberosity. And that's how I connect my biceps brachii. It inserts at the radial tuberosity. So radial tuberosity, as I come down to the distal side, the furthest projection, that bump there, is the radial styloid process. So another styloid process, and I imagine this kind of looks like my thumb when I place this out. So I use styloid process, and then on this side, on the medial side, I have another groove here, and that's called the ulnar notch. Ulnar notch. And why do I have an ulnar notch? To connect my ulnar head. So as I look at this, I'm using my radial head to connect to my radial notch of the ulna. I'm using my ulnar head to connect to my ulnar notch of the radius. So my heads and notches go together. So we're determining right or left with this. As I come down, I said my radial tuberosity is anterior. So I have to keep this anterior. And I just remember, again, this kind of looks like my thumb in anatomical position. This would stay on the anterior side. So this is a right. If I put this on my left side, my styloid process is going the wrong way. So this is a right radius. So here's a quick review. We did Manubrium, body, Xiphoid process. We learned that our clavicle has two ends, a acromial end and a sternal end. We learned that our scapula has three borders to it: a lateral border, a medial border, superior border. The main projections, coracoid process. On the posterior side, acromial process. I have a glenoid cavity with the supraglenoid tubercle, infraglenoid tubercle to connect to my humerus. And we said our humerus, as I come down, has a lesser tubercle, a greater tubercle with the inner tubercular groove, deltoid tuberosity, and my condyles, epicondyles, lateral, medial, capitulum, trochlea. When I look at my ulna, we said my two processes: Olecranon process, Coronoid process, trochlear notch, radial notch. As I come down, ulnar head, ulnar styloid process, and to the radius, radial head, radial tuberosity. As I get to the distal side, radial styloid process, and ulnar notch. So this completes as we get down to the arm. You can review the video on hands and feet once we get past the ulna and radius.